So I've used services on and off for the last 30 years, primary, secondary and voluntary services. There's times as well that I've completely disengaged and used drink, drugs and self-harm. I think that the last time I was really unwell was about 7 years ago. I'd always struggled with depression and anxiety, but I'd been manic and I'd had a psychotic episode. I've had negative experiences a lot of the time in the past, and knowing how unwell I was, where I would have gone, I'd have ended up being sectioned, and it would have been a mixed sex ward, you know, in a bay, and I'd have got extremely anxious, very angry, and you know, I think I was about 6-7 stone heavier then, and that would have been quite intimidating. I wouldn't have wanted to be there, and I know I would have been restrained, and the thought of that, I knew I just couldn't cope with that. So for me, I made the decision and I just ran away and stayed in the tent for a month. I think the few moments of clarity there, my thought was that I wanted to get a bit better before I got help, and you know, and I did that, and you know, after a lot of sort of to and fro, and in the end, I was seen as an outpatient. So I'm a national advisor on the programme, and I do some trust visits, and I help with specific areas that I have experience with, so it might be sort of peer support, co-production, and anything like that. And I really hope that this part of the project, you know, can reduce restrictive practice in itself, but also the knowledge that things are changing and for people in the future, and that they won't be put off coming, and that going into hospital won't be in some cases just as traumatic as why you're going to hospital in the first place.